The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome, everyone. This is Jamie Upson. I am one of the financial advisors at Stonehearth, where I've been now for the last 18 years. We have a great turnout today. This is a sign that people certainly have questions about Medicare benefits. Before we get started, I want to review a few housekeeping items. On your GoToMeeting taskbar, you should see a section titled Questions. Please feel free to submit your questions throughout the course of the webinar. And my colleague Amanda Sylvia, she'll be monitoring these questions and she'll ask Brian to answer as many as time allows towards the end of the webinar. If we happen to run low on time and we are unable to get to your questions, one of us will reach out to you directly after the webinar to make sure we get your questions answered. Now I'd like to introduce our guest speaker for today. Brian Lynch is the owner of Lynch Insurance Group located right here in Massachusetts. I've known Brian now for, I want to say, about 4 years. Brian is a licensed insurance agent specializing in creating optimum value in life and health insurance packages for both groups as well as individuals. He works with virtually every major provider available in a given state to provide the best solutions possible for his clients in both the employee and the personal insurance planning arenas. Welcome, Brian, and thank you for joining us again to present on Medicare.
Thank you. You hear me all right?
I can hear you perfect.
All right, great. Yeah, so Jamie and I did this last year and decided to give it another go this year because we got some good feedback on it. And, I think Medicare is one of those things that's always a bit often misunderstood, I should say. It's overcomplicated by some of the, everyone's got an opinion on things, and including the mailbox that's full for 6 months around open enrollment or when you turn 65. So a lot of times it can get a little bit confusing just because of the gluttonous effects of the information that's out there. And really what I try and do with this is just simplify things and bring it down to just the basics. We're not going to look at specific plans. We're not going to talk about specific providers. We're just talking about basics of Medicare. What does original Medicare do? What are enrollment periods? How does all this work? So that hopefully at the end of this, you feel a little bit better about the clarity of things. And if you have a desire to look at specific plans, you have an understanding about what each one of them does well and not so well based on this basics presentation. So just get into this here. Just trying to get that. Here we go. So I'm about 15 years into my insurance career. I've licensed with there's some carriers that don't work with brokers, but very, very few. So we're licensed with pretty much all of the carriers out there that offer Medicare through a broker channel. I'm an independent agent, so I have no direct affiliation with any of those companies, which allows me to be a little bit more impartial and give you more of a common sense view of the pros and cons of different carriers, not having a dog in the fight, so to speak, about what plan will make sense for you in the end. So one of the disclaimers here we like to put out is that a lot of this, as paradoxical as it might sound, a lot of the information that the Center for Medicare Services releases on rates and products and all of the ins and outs of Medicare does not come into effect or is shared with the general public until on or just before October 1st. Now, Jamie and I try and schedule this webinar as close to October 1st as we can to make sure that we're getting, in that mode of, open enrollment coming up and, getting as much up-to-date information as we can. But that being said, some of the rates and some of the stuff that we're going to look at is based on 2019, where 2020 was not available. The second part of this disclaimer is important. This presentation is by no means meant to encompass all pertinent information used to make an informed Medicare coverage selection. Full complement information can be obtained from the Center for Medicare Services or via Medicare.gov to assist with these decisions. This is just meant to be a broad overview and hopefully as far as what the basics are. So first thing is, what is Medicare? This might be, known to all of you on the call, but it's important to kind of start from scratch here. So it's a health insurance for people over 65, people under 65 with certain disabilities, and people of any age with end-stage renal disease, which is permanent kidney failure requiring dialysis or kidney transplant. So we're meant to serve a certain market here, and the starting point for that coverage is what's called original Medicare. Original Medicare is two parts, Part A and Part B. Part A is defined here on the screen here as the hospital insurance section of things. So we're talking about inpatient care in hospitals, skilled nursing facility care, hospice, and home health care. Out of pocket for the insured as part of Part A, and again, these are 2019 numbers, which will be updated shortly for 2020, $1,364 deductible for each benefit period. Benefit period is an important statement there because the deductible is per occurrence. So when you're coming from a health insurance world where the deductible is traditionally per year, and you go to this where Medicare is deductible per occurrence, if you had multiple hospitalizations in a year, you might have multiple deductibles to satisfy. If the hospitalization is 61 days plus, you're going to pay a per day hospitalization benefit. And you see even beyond like the lifetime reserve days, you're going to pay all costs. So, it's staggered based on the severity and based on the timing of that hospitalization, but also based on the frequency of hospitalizations. You could have multiple deductibles, as I said. Part B is, essentially Part A being the hospital. Part B is the medical, so inpatient versus outpatient. These are services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment, and many of our preventative services. Out of pocket for the insured will include a deductible yet to be defined for 2020, but to give you an example, 2018 was 183, 2019 is 185, so it wouldn't fluctuate all that much, I would think, coming for the next year. But basically what you're going to have is that deductible, and then in a lot of the areas we're going to look at, it's built like an 80-20 plan, where the insurance is covering 80%, original Medicare, I should say, is covering 80% of the costs that you would incur for Medicare approved services, and then you would cover the other 20%. So that's not universal, but that's the vast majority of the major categories. As far as what you pay for this, original Medicare package, Part A is really kind of a rite of passage turning 65. There's no cost for Part A as long as you have 40 quarters into Social Security. If you don't have 40 quarters, there is a premium, and those two are defined below that based on the number of quarters that you have satisfied. Part B, there is a premium for almost all, most people that are not in that Medicaid realm. You would have a $135.50 a month base rate for 2019. I think in 2018, I have to look up the exact number. I think it was 134. So it's, again, similar to that Part B deductible we looked at. There is a change year to year on what that number looks like. We don't have it for 2020 yet, but it would be likely within a couple of dollars. Premiums can be adjusted based on income via a 2-year look back. So what we're looking at is your 2019 Part B premiums are based off of 2017 income. 2020 will be based off 2018, and it goes forward like that. So this is important because there's a couple of, kind of areas that would skew the cost of Medicare a lot differently than it is normally. And this would be the first one we look at, which would be the income adjustments to Part B. And you see that table here. So you have the base rate would apply to anyone that is 85,000 or less as a single, or 170 or less of a joint filing status, modified adjusted gross income. If you go beyond that, you see the table would then show an increase in Part B premiums based on the overall modified adjusted gross income for either that single or that household, all the way up to $460 a month. So you can see a $325 increase in your monthly costs, especially if you have a couple. Medicare as an individual benefit, so that's going to be per person. All of a sudden, the value equation can change pretty quickly. Sometimes it comes into play that there are people that have a 2-year look back to a significant income, but they've since retired, and there is an ability to file an appeal on these income adjustments. And I do see that a good amount of times being successful. If you don't have that income anymore, you can say we're not able to justify paying that extra money, and they usually will grant those, but it's case by case. We can't, we don't control whether it was approved or not, but there is an appeal process if you feel like it's not justified that you get that increase.
And Brian, this is Jamie, and I have definitely had a lot of clients coming to us that have been surprised about those rate increases. And something new over the last 6 months is I have heard clients winning or people winning those appeals, which was something that I have not heard until starting about 6 months ago.
Yeah, and I don't like to get people's hopes up that they're definitely going to win that appeal, because that's that's when you get yourself in trouble for saying it. But I'm in the same boat. I always thought, like, most of the stuff you do with the government, when you appeal, it's usually just you kind of wasting time and paper. But with this, I have seen some success lately. The big thing on the application for Part B is if you do not sign up when you're first eligible, you may have to pay a late enrollment penalty. So we're going to go over exceptions in a minute, and exception that applies to a lot of people. But if you're first eligible and you pay a penalty, the penalty is payable for as long as you have Part B. And the premium can go up as much as 10% for each full year that you could have Part B but did not sign up for it. In addition, there's also general enrollment periods for people that are late enrollees. And you basically would have to apply between January and March, and coverage will not start until July. Now, why they have such a staggered timeline for these cases, I don't know, but it definitely can, beyond just not having the coverage, it makes it much less attractive to try and defer it. Now, the main reason people defer Part B is, you sign up for Part A and you defer Part B is if you have coverage through an employer. So that's one of those exceptions where you can sign up for Part B during a special enrollment period when you lose that employer coverage, and there will not be a late enrollment penalty. So because Part B has a premium associated with it, and because it's somewhat redundant in a lot of cases to an employer coverage, you see that that's where people will basically elect to defer Part B. If you're paying for coverage yourself and you're doing everything on your own, usually the value on Medicare is going to be better than health. Sometimes you'll have group plans that will force you into a Medicare situation. But if you're able to keep that group health where your employer is paying a portion of it or all of it, it's likely you'd want to keep that health plan and defer that Part B. And then when you do sign up, rest assured, if you're doing that within the special election period, there is no late enrollment penalty. So the question comes from there is, we talked a little bit about how Medicare is structured. Then the question comes, if that's not enough where you feel comfortable with that coverage, because there is a lot of percentage-based coverage. There's no clearly defined out-of-pocket maximum on original Medicare. So that can be a bit concerning, especially when you get 20%, 20% of God knows what, if you don't have an out-of-pocket max. A lot of people, not willing to risk that. The other thing is original Medicare does not include prescription coverage. So there's a couple of big things that A and B do not provide that we, a lot of people will want to seek out options to get elsewhere. And so really at that point, that's why I say, like, things in the mail and things when you talk to friends and family, they may kind of confuse you with all of these options you have from that point forward. And really to simplify it, I want to make it clear, it's just a fork in the road really of two options, two major categories of things you can do. There are obviously branches out of each of these options, but if you focus on the two options and consider it kind of a fork of what makes sense for you, it can make it a lot easier, because we might be able to eliminate a good portion of the options just by the sheer idea that one option sounds a lot more attractive as a general category than the other. But if we talk about these two options, there's going to be a Medicare supplement route and a Medicare Advantage route. So we're going to go over these in detail, but those are basically the two major categories we're going to focus on. So Medicare supplements, also referred to as Medigap plans, are sold by private companies. Some of them in Massachusetts would include Tufts, Harvard Pilgrim, United, Fallon. There's the kind of key players that you see the names, and again, they bombard you with marketing materials. Those are what we're talking about, private companies. They can help you pay some of the healthcare costs that original Medicare does not, like copays, coinsurance, and deductibles. If you have a original Medicare, and you buy a Medigap policy, Medicare pays their portion of the Medicare approved amount for covered healthcare costs first, and then your Medigap policy pays its share. And they will also offer coverages for services that Medicare does not cover, which things like coverage outside of the U.S., fitness reimbursements. Some plans may have value-added services as well beyond that. To get a supplement plan, you must have Part A and B. Part B premium is still paid to Medicare, so that's a separate charge that you're paying for that Part B, that base rate of $135.50 we looked at before. That's paid no matter what you have beyond original Medicare. The big thing here that is attractive about a Medicare supplement is its access to any doctor or facility that takes Medicare. So there's not a lot of questions about what that network looks like. If your doctor or your hospital or whoever you're used to seeing takes Medicare, they take your Medicare supplement. So it almost, beyond customer service, obviously, and the premium of the policies being in comparison, the benefits are standardized and on the original Medicare, kind of what they cover and what they complement to Medicare. Really the network is not an issue, so the carrier becomes less of an issue. We're not talking about, does this person take Harvard Pilgrim? Does this person take United? Do they take Medicare? These plans do not include prescription coverage, so we'd purchase that separately with a Part D plan, which is the prescription arm that's, Part D refers to as the RX plans. As we talked about, you're still paying Part B to Medicare, to Social Security, essentially. Then the premiums for the Medicare supplement are paid directly to the carrier. You're not able to pay for a Medicare supplement with a Social Security deduction. So where do we get that Part D coverage? And at this point, we're talking about that Medicare supplement option where we have original Medicare, you have the Medicare supplement, and then you have the Part D, and that's kind of your total, Medicare solution there. Part D plans provide standalone drug coverage. Plans vary greatly on design and premiums. One of the big things you look at is a formulary list. It can be very different what drugs are covered and what tier they fall into from plan to plan, from carrier to carrier. So it's always highly recommended that you vet out the prescriptions that you're currently taking so that we can see what the projected costs are for those Part D plans. Projected costs from one carrier, or even plans within the same carrier can vary widely. And so if you don't take that step and you say, oh, my brother told me this plan's great, or my neighbor says he loves this plan, if they get one prescription that's different than yours, it can totally skew whether that's a good plan for you. So it's always better to look at your situation personally and try and do your best to, use that actual information to figure out what plan makes sense for you. Some plans have a deductible. The lower cost plans usually will have a deductible. The cap on that deductible for 2020 is $435. Deductibles typically on most plans will apply to beyond generics. So like the tier 1 and 2 drugs will be, just a copay, even if there's even a copay involved. And then the ones beyond that will have that deductible. The average monthly premium is $32.74. That's, it's just giving you an average to give you an idea, but there's plans anywhere from $15 a month up to over $100 a month, depending on how you design it. It's just a matter of what makes sense for you on the total cost, the premium plus the out-of-pocket on the medications. Prescription coverage on Medicare is structured very differently than prescription coverage on a health plan. So it's not just copays, and you basically can kind of set your watch to what your copays are going to be on those medications for the entire year before that plan renews. There's going to be stages to Medicare prescription coverage. The first is there's a deductible. If there is a deductible on the plan, I should say, that would be the first phase. Then there's an initial coverage stage where prescriptions are covered on different tiers. So this part is very similar to what people see on their health plans going into Medicare. So you have, 5 tiers typically on these plans, and it would be anywhere from low-cost generics to non-preferred generics to preferred brand names, non-preferred brand names, right down the list. These are based on the formulary list for that carrier, so that's where you can see a lot of the separation on one carrier to another and what you would pay for those medications. Once your total drug cost reaches a threshold, in this case, $4,020 in 2020, you go into the coverage gap stage, which sometimes people refer to as the donut hole. You basically, at this phase, you pay no more than 51% of the total cost for generics or 40% for brand names. But that's why I say, different stages of the year can lead to different out-of-pocket exposure for your medications. So it's important that you vet out these plans. Once your yearly out-of-pocket drug cost reaches another threshold, which would be $63.50, you would then enter the catastrophic phase, which you pay the greater of 5% of $3 or $3.60 for generics and $8.95 for brand names. The different stages. You may, if you have low-cost generic medications, you may never get out of the initial coverage stage. That's the case for a lot of people. But if you have more expensive medications, you have to be aware that when you projected down to that coverage gap stage, there might be some more out-of-pocket exposure there. And obviously, your medications can change over the course of the year. So even if you don't have any significant medications, it's important to be aware of how this is structured because it might change for you during the year if a medication is added. Now, there is a late enrollment penalty for Part D as well. So, you'll get, sometimes I meet with people and they'll give me the case that, I don't have any medications right now. I don't see a need to pay for prescription coverage. Why would I do that? The reason you would do it is because of this late enrollment penalty. So if you have more than 63 days after your initial enrollment period and you go without a prescription plan of some form, you're going to have a penalty that's 1% of the national base premium times the number of uncovered months. So it doesn't sound like a lot, but if you're talking about a base premium that a penalty that's added to your base premium, and that penalty has to be paid for as long as you have Part D, i.e., in most cases, the rest of your life. It's not really worth going without it if we can get a low-cost prescription plan on there and just kind of be there as a placeholder until prescriptions do arise. The money that you pay in the penalty is probably going to exceed the money that you put into it to have it there from day one. So it's usually worth exploring regardless of your prescription situation. As we talked about with Part D can also have income adjustments. They're not as severe, but every little bit is important to be aware of. So pretty much same income table, but you see the base premium for the plan plus whatever amount that income adjustment applies to in your case. The same base rate is 85 or less for an individual filing, 170 or less for a joint filing. That would be the base premium for the prescription plan. Anything beyond that, you're going to see a little added costs like you see here. The initial election period for Part D is if you're newly eligible for Medicare, you get a 7-month period, 3 months before, the month of, and 3 months after the effective date. If Part B is delayed, like if you had an employer coverage, you would have 3 months before that Part B effective date to get that coverage in place. When the individual is first eligible to enroll in Part D, that's just called something a little different. It's an initial enrollment period. A, B, and D are on the same date. So this is a little bit of minutia just to kind of go over that there's different enrollment periods based on your situation. This is going back to the original disclaimer about not having an all-encompassing view of these because it would just be like we're reading the dictionary here. We don't overdo it with the minutia, but if you have a question about what enrollment period or what election period you have available to you for a situation, someone like myself or the Center for Medicare Services, Medicare.gov, these are the resources you could go to for those answers. So stopping here for a second, we talked about Medicare Supplement. Medicare Supplement being Part A and B, the Medicare Supplement, and the Part D plan being the components there. The big advantage to that being that it's accepted anywhere Medicare is accepted, and then you can get a supplement plan that can cover every Medicare approved medical claim. They can pick up everything that Medicare doesn't pick up with certain products. We're going to go over in a second some changes that might be coming there on the horizon, but those are the big things for the Medicare Supplement. Now, because it's kind of available anywhere Medicare is accepted, so the network is really a non-issue, and then it can be covering everything that you would need covered with very little to no out of pocket. Some people can consider that a little bit more than they want and a little bit more than they want to pay for, and so the alternative on the other side is a Medicare Advantage plan. So this is the second option in that fork in the road. Again, offered by private carriers. And these are basically meant to be a replacement of original Medicare. So where we talked about the supplement being a complement to original Medicare, this is a replacement. And that term replacement can be a little bit confusing, but basically all it means is that the care administrative tasks are managed by a private carrier rather than the Center for Medicare Services. So, your original Medicare kind of taking the pieces of that into a more all-encompassing type of plan that's going to include some additional services, and it's going to be managed by a private carrier like we talked about, like, United or Harvard or Tufts or any of these carriers. Basically, these are taking ownership of your care, essentially. Because they're doing that, the carrier is paid a stipend from the Center for Medicare Services to provide the services. So these carriers are getting paid on the back end by the government to manage your care. And so that allows them to offer plans that have greatly reduced premiums, sometimes as low as zero. So you can have a zero-cost Medicare Advantage plan. You would still pay Part B premiums, but you may have no additional cost if you go with select Medicare Advantage plans. Now, there are zero plans all the way up to plans that are, 100, 200 plus a month. It just depends on the structure. So just kind of giving you a window into the fact that there are plans like that out there, and that's why, because the carriers are getting paid regardless of which plan you select, so they can offer plans that may be as low as zero. All plans that the carriers offer must be at or better than the benefits that original Medicare offers. So most Medicare Advantage plans will offer, everything the base plans offer, but also extra coverage, value-added services like vision, hearing, dental, health and wellness programs. A lot of times you'll see them take percentages that were on original Medicare down to strictly copays that are on the Medicare Advantage plan in some of those outpatient areas we talked about. So these are, again, at or better than original Medicare, but usually there's a lot of enhancements that they're designing. Obviously, they're competing against each other for your business. There's more bells and whistles going into these plans every year with different ways they structure them. With the Med Advantage, there are various types of network designs, HMOs, PPOs, private fee-for-service, point of service. So these are subject to networks that's through the carrier you can take coverage from. We talked about the Medicare supplement. One of the things I highlighted was that it's accepted anywhere Medicare is accepted. Now, the Advantage plan is accepted anywhere that carrier is accepted. So this is important. You got to verify the availability of your doctors and hospitals, make sure that the people that you want to see or the people you may want to see in the future are going to be available to you on the plan you select. May or may not be available outside of your home state, depending on the carrier and the plan design. Even within your home state, there's going to be restrictions on what that network looks like. And so you want to be aware of what those networks look like. Most of the Medicare Advantage plans will include a Part D plan as part of the coverage. So where with a supplement plan, we're getting Part D separately as a standalone, the Advantage plans are able to be kind of a one-stop shopping, if you will, a little bit more, and they can build that Part D coverage into the Medicare Advantage plan. So the RX is included with the health benefits, and it's all under the same umbrella. These plans vary greatly in terms of deductibles, copays, out-of-pocket maximums, even provider networks, plan designs, premiums. They can change each year. So you revisit that decision on a year-to-year basis. We're going to talk about that open enrollment period. But again, that's why we do these calls now. We'll go over that in one of the following slides. But every year you have an opportunity to reassess and either keep the coverage you have or make a shift to something else if you wanted to. For these Med Advantage plans, the last thing here is premiums can be paid via check, EFT, or Social Security deduction. So that's the important one we talked about. It. Supplement plans cannot be paid with Social Security deduction. Advantage plans can. So if you wanted to have it run through Social Security before that Social Security check even gets to you, a lot of times that's kind of the set it and forget it approach to the premium payment for Med Advantage plans. Just talked about the election period. So the annual election period for 2020 begins with plan reviews on October 1st. So you can't actually sign up for a new plan until October 15th, but you can meet with someone like myself or another independent agent or broker. You can meet with Medicare representatives of any kind that are licensed and that you have access to, and they can start reviewing your benefits on October 1st and your options for 2020. October 15th is when they can actually do an application, or you can do an application for yourself. October 15th to December 7th is that true open enrollment period, that annual election period. Before October 1st, part of the reason why this presentation is designed the way it is we can't go over plan specifics. It's not something that the CMS regulations allow. And so you have to wait till October 1st, and the 1st through the 14th is that window to just start to review options. 15th to December 7th is the time to sign up for your 2020 plan. You can enroll or disenroll in those Medicare Advantage or Part D plans. All effective dates for those plans are going to be effective on January 1st of 2020, whatever changes you make during that period. And it's the last enrollment request made, determined by the application date, that will be the enrollment request that takes effect. So if you have multiple, you do an application October 15th, and then you speak to someone else and you decide a different plan makes sense for you to do a new application on December 1st, that second one would then be the one that would be effective on January 1st because it would supersede the previously submitted application. Outside of open enrollment to the annual election period we just talked about, when do you have options to sign up for these things? Essentially, you're talking about special election periods, or SEPs for short. These are periods outside of those generic calendar type of periods where the individual may elect a plan change or select your initial plan. So these examples of these types include change of residence, involuntary loss of drug coverage, gaining or losing Medicaid, gaining or losing Part D low-income subsidy. The big special election period we talked about before was the loss of employer coverage. So that would be a big one that you'd see that reasoning for signing up. As of 2019 and continuing in 2020, there's this open enrollment period. So it's confusing with all these acronyms, a little bit of alphabet soup, but the annual election period we talked about before is October 15th to December 7th. This open enrollment period is January 1st to March 31st. And basically it's for individuals who are in a Medicare Advantage plan, and you can make a one-time election to go to another Medicare Advantage plan or back to original Medicare. And you coordinate that change with an add or drop of Part D coverage. So this sounds a bit confusing, but the idea is that if you signed up for a Medicare Advantage plan during open enrollment, you got into the year and you decide, you know what, I made a mistake, this is not a plan that works best for me, you are able to reassess that decision and have a one-time election to a new Medicare Advantage plan, different plan, or you could go back to original Medicare, get a Part D plan and sign up for a supplement. So, your involuntary disenrollments is if you are a bit different. These are voluntary changes. Involuntary would be you move outside of the enrollment service area, you lose A or B, obviously member passes away or the plan contract is terminated and you get a notice from your carrier they're discontinuing operations. So these are all election periods and election reasons you can elect new plans or a first plan. That's essentially all we have as far as slides go. I know there's some questions coming in that we want to address, but I think that hopefully this was helpful in terms of outlining the basics. I know there's a lot of different components that we talked about, but again, I think if you get into your personal situation and your personal needs with someone like myself or a representative that's CMS appointed and has knowledge of the market, it's usually pretty easy to collaborate and number one, to obviously simplify things. That would be first and foremost, but then to figure out which plan, give you the tools that you need to figure out which plan is going to work best for you personally. And then as we talked about, there are definitely election periods every year, annually, if not in between, depending on your situation, that you have the opportunity to reassess and look at those plans again. If your needs change or if the plan's not working well, it's not like it's a lifetime contract. We have the ability to modify things on the fly and find that right fit for present day. But I think it's biggest thing is just dividing it into those two major categories, the Advantage plans and the supplement plans, detailing what they do beyond what original Medicare is doing for you, what the premiums are going to be for those plans, and finding the right fit for you personally based on those high level pros and cons on those options.
Brian, thank you so much. I didn't mean to cut you off here. if you're ready, I'm ready to move ahead with some questions.
Yeah, that's what I was going to say. Fire away with the questions, and we'll get through those.
Yeah, so before I do, just want to remind everybody here, there is a question section on your taskbar. You can submit your questions there, and I will get them on my end. And if we do have time, we will ask Brian all of those. But before I do, just want to review this slide right here. Upcoming webinars, we have CIO's Corner that's with our Chief Investment Officer at Stonehearth, Chris Gauthier. He's going to discuss the quarterly update. Then we're doing charitable donations in November and solo 401ks for the self-employed in December. You can sign up for those on our website there, www.stonehearthcapital.com. We would love to have you. Brian, just to get started here, it looks like the first question I have is, I'm turning 65 next year. I plan to continue working for my employer who offers health insurance. I've read that whether or not I have to sign up for Medicare benefits is dependent upon the size of my employer. Is that true?
Yes and no. I mean, I think what we addressed a little bit before in the prior slides were that if you have coverage through an employer, typically you're able to keep it. You basically check with your HR department or that employer directly to kind of make sure that your plan allows you to keep it. It actually varies not just on the size of the company, but on the insurance carrier. Some of them will allow you to keep over 65 employed individuals on your plan. Others will have you kind of forced into switching to a Medicare extension. Some of those like group MedX plans, you see that a bit. But that all depends on the carrier as much as the size of the business. The size only really matters in terms of who pays first. So if you have an employer plan, usually you're going to elect to take that Part A because it's kind of a rite of passage turning 65. As long as you have those 40 quarters into Social Security, you're not going to pay a premium for that. So you'd put Part A in place, and then you would defer Part B. So if you have that Part A in place and the employer coverage, if you have a employer that has 20 or more employees, your health plan would pay. Your Medicare plan would pay first for 20 or more employees, and the employer would pay second. So your work health plan would pay as a secondary coverage to Medicare. If it's less than 20, it's going to flip, and the employer plan would pay first. Medicare would be secondary.
The next question we have is, with a large doctor and hospital network here in the Northeast, do you see more people moving towards Medicare Advantage?
I think it's really case by case. Medicare Advantage has definitely a good component, a good piece of the market is tied into Medicare Advantage, and I think that both major categories provide really strong advantages, but also disadvantages. The market that we have in Massachusetts obviously has a vast number of quality, top of the country level doctors and hospitals. So even if there's limitations sometimes in the network, there's still enough high-level providers that people are comfortable. But it's truly, that is the defining factor, is the comfort level. Some people want to have that set it and forget it approach of a Medicare supplement where you pay additional premium to know that you can go anywhere with it that takes Medicare, and you can get a plan that's as high as like every Medicare approved service covered 100% on the medical claim side, and they're much more comfortable with that. If you want to go to a Medicare Advantage plan, some people would much rather pay that lower premium and go as more of a pay-as-you-go approach, because those plans will have co-pays and deductibles in different areas, and they'll, you'll pay some costs associated with medical care in a lot of categories, and you'll have to make sure you're clear on what doctors, what hospitals take the plan. But some people look at it, and as long as we're vetting that stuff out in advance, and we're saying, what doctors, what hospitals are important to you now. Obviously, we can't predict the future. There might be specialists you need access to that we can't account for at that given time. You might need it halfway through the year. We do have those open enrollment periods to switch. But, again, there is such an expansive network of doctors in Massachusetts that usually there's going to be someone there that you'll be able to see for any situation. I think with Massachusetts, you do sometimes see that Medicare supplements are more popular in other parts of the country because our health insurance is so expensive. And, that may not be something that you would think would make a difference. But I think when you look at going from a health plan and even you go to a supplement plan where you can go anywhere and there's no deductibles, no copays, you're going to have a situation where there's a good amount of savings even in the highest level plan, because the health insurance at 64 years old was so expensive. They're okay with doing that. But obviously you'll see, in most cases, depending on the design, you'll see a better savings on a Medicare Advantage. So if you're comfortable with the network, you go that route. So, long-winded answer to just say it kind of depends on the individual and what their priorities are. And I think there's a place for both.
The next one we have is when you're joint filing, the table that you showed us lists that there's a charge. Is this per person or for the household number of people?
Yeah, so Medicare is all individual benefits, so it's per person. So if you have it's a household, like a joint income for the household, but that extra charge would be per person. So each person's Part B premiums would be affected. That's it's filing for Medicare.
And that's true for Part D as well, right?
Correct.
I'm just going to go back to Medicare Advantage for a second here. It says, I heard that Medicare Advantage is going to be expanding some of its benefits to include lifestyle support like meal deliveries and the installation of shower grab bars. When will this go into effect?
I think as we talked about in the Medicare Advantage section, you kind of see carriers continuing to expand their offerings every year. And this year is no exception. I think in 2019, we saw a lot of this. I think it will continue in 2020 as far as like creative ways for these carriers to offer things that might not be like hard fast about what it covers, but giving people options about, what they need covered personally. Meaning there'll be like, benefit wallets on certain plans that will give you X amount of dollars that you can use towards over-the-counter medications, or dental plans that won't be designed with like specific benefits that are earmarked, but like a certain amount of allocation you can use towards dental expenses. And so, the items you mentioned, I mean, there are, again, these benefit wallets that can be used for medical services that might not be covered by a base Medicare Advantage plan, and then you can use them as you like based on what you need. That flexibility is becoming more popular, I think, with some of these plans as they try and kind of compete against each other to see who's going to meet the most needs for people personally by offering kind of more general benefits that will allow people to decide themselves what they need done.
Brian, I think I've got just one more here for essence of time. It says, I've read that Medigap plans vary in benefits that are categorized by letters in the alphabet. Is that true for all states? No. Massachusetts, as some of you on the call, if you're from Massachusetts, may know, is usually its own animal, and this is no exception. Medicare supplement plans in Massachusetts are defined. Right now there's a supplement one and a base supplement plan, which you have a very limited number of options. They're very strong options, but they're not as varied as you see in other states. So in most states that follow the federal guidelines, you will see those letter-based coverages. You'll see Plan F and G and N and M, and those will vary. What plans each carrier offers will vary by the carrier. But Massachusetts does not have letter-based supplements. They have supplements that are based on a core and a supplement one, for example. And there may be two options, or much more limited than you see in other states, and they're not classified by letter. Brian, I think that's it for the questions. Jamie, did you have any final words?
I do. Well, first I want to thank Brian for presenting today. I think this is his 4th year presenting on Medicare for us and our clients, so I appreciate that. Brian, if people have follow-up questions for you or want to schedule time with you to go over Medicare plans and which ones are right for them, how would they reach you? So I think my contact info is here. There we go. So my contact info is on the screen now if you want to reach out. It's really kind of anything from general questions up to assessment of current coverage, to where if you age in, you need help, just kind of getting that process started. I'm happy to do any and all those things. So feel free to reach out if I can be of assistance. Good. Thank you, Brian. So I just wanted to reference that Stonehearth has been providing these monthly educational webinars like this one for the last 3 years, or maybe it's actually been 4 years. We use the feedback from families we support to determine what areas to focus on within these webinars. So keep that feedback coming in, please. For those of you participating in the webinar who don't know or don't currently work with Stonehearth, just to let you know, we are a private wealth management firm. We are fiduciaries, and we've been in business since 1982. We focus on managing and identifying opportunities for families we support. And obviously today's webinar was focusing on the health-related risks. If you'd like to schedule a complimentary initial consultation, please reach out to us. You can give us a call at 978-624-3000, or you can send any of us an email or use our generic email at info@stonehearthcapital.com. Once again, thank you everybody for joining us, and thank you, Brian.
Thanks, Brian. Everyone take care.
Thanks.